AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening. This is Jay Feldman filling in for Lorena Anderson. This is Jay Feldman, your executive coach, combining the best merits of executive coaching in business, science, and spiritual. This show can be seen on www.allcountyhealthcareinc.com and www.nnradio.com. Our call-in number for today, if you want to be part of the conversation, is 888-565-1470. And this is You and Your Doctor, Living Longer and Healthcare at amptv.com production. And we're sponsored by All County Healthcare, Inc., where patients are the heart of our business. And call toll-free again, 888-717-7170 for more information. Today, and we also have online, Dr. Presley is with us today too.
Preste.
I'm sorry, Dr. Preste is with us today. Welcome, Dr. Preste.
Thank you.
And our guests today, of which we have three, we have the combination of Eve Preste is here with us today, who's a hypnotist, meditation, and Reiki master. She's got many combinations of different modalities she's going to talk to us about today. And we have Tom Widerski, who is a life coach and nutritionist, and he's going to be talking about cardiology and the evolution of how we, from the time we're really kids, we have some problems that are brewing with us. And we also have Dr. Preste on, who is a specialist in diabetes, who will be talking about diabetes and hypertension. So let's kick off the conversation. Eve, welcome. We'll kick off with you.
Good afternoon. Good
Hi.
evening, Jay. How are you?
I'm great.
Wonderful.
I'm excited about the experience, and I'm hoping that I don't get hypnotized while we chat with you today. But
you might be getting very sleepy.
If I get very sleepy, somebody better pitch in on the call. But tell us a little bit about what you're going to be talking about today.
Today, I'm going to talk about everyday life. There's a lot of stress, anxiety. People get panic attacks. In today's world, everyone's in a rush. We just need to take time to just stop, deep breathe, and relax. When you relax deep from the diaphragm, and you breathe deep, you breathe in and out, it just shifts your energy and the energy around others. So I teach my client the number one things when I do my hypnosis sessions to deep breathe and just relax the mind. Once they start relaxing the mind, I work this with the subconscious mind. Right now, we're in a conscious waking state, the alpha state, where we are alert and we know what we're going to do and we're thinking about what we're going to do tomorrow or the next day. But we're in this deep, dreamlike state, which is the delta, theta state. That's where I plant subconscious positive images and things in the mind of the client where they want to overcome, or they want to stop smoking, lose some weight. They have fears of flying, panic attacks, nail biting. There's a myriad of things that I treat with hypnosis, and I'm having a 95% success rate with my clients. They're overcoming their fears and their phobias, and I really enjoy. It's a passion with what I do. It's just a great thing to be able to help someone just by helping them relax. And also, I teach them the benefits of meditation. Meditating, go to that deep place where they can just take some time for themselves to relax and be still and quiet. And then also I do Reiki, which is I balance the 7 chakras of the body. And I use my hands and I implant energy over their bodies. And there's 7 chakras in the body. There's the root chakra, the sacral, the solar plexus, the heart chakra, the throat, the third eye, and the crown. All these chakras, sometimes there's an imbalance in the body. Sometimes imbalances create disease. or imbalances, like when you're highly stressed, the cortisol levels in the body rise. And that's a problem with your adrenals, because it's an adrenaline rush. When you're nervous or you're anxious or you're scared, that adrenaline goes up in your body and you have this hormone imbalance with cortisol. And a lot of times diseases occur when there is an imbalance in the body. So I help people, medically now in hospitals, the doctors, before patients have surgery, doctors are using Reiki masters or Reiki practitioners to come into the hospitals to administer the positive energy and to calm someone down before surgery, because a positive outlook, a relaxed body, promotes a healthy, well body, holistically.
Well, what's fascinating is the trend today. I work with a lot of executives, particularly the Wall Streeters, and they are really stereotypically pretty stressed. And the trend seems to be that even they are leading the charge in terms of meditation and some of the other things you're talking about. Maybe help our listeners understand this trend to where previously phobic executives are now embracing this.
Well, because we need a solution. That's the answer, because people are on anxiety, they're on medications. We want to move away from someone being highly medicated and being, they depend on medications. We want to move to a place where the whole body mind is just holistically treated by exercise, positive reinforcement, a life coaching where someone needs just that extra push in the right direction, a friend, someone who can coach them, someone who can help them and believe in them. Sometimes it just is a matter of being there as a friend or someone who really understands them, and then it can get them to everything is possible with a positive mind. Once your mind is in the right place, everything is achievable, and success is yours when you have a positive mind.
Well, you can see the passion, kind of like just in your smile comes through in terms of all of this. Well, how many visits typically does the patient need for this?
Everyone is individual. I might be able to. I've helped people. I had a lady who was smoking for 50 years in one session. She quit. Another one, 35 years in one session. So sometimes it might take a longer person who needs more reinforcement. Depending on the person, what I do is I do a intake form. I really get to connect with the energy of that client, because everyone's different. Once I really understand where the person is coming from, what their fears are, what they tell me about that's important to them. Maybe I can connect with their child or their dog. In that session, I connect them with someone that they love from the heart, and then that really puts them deeper into a relaxed state. And then I go ahead and I infuse in the subconscious mind, the dreamlike mind, all those positive influences and pictures and how it's going to feel when you achieve. Let's say, for instance, someone wants to lose weight. How will that dress or how will that outfit look on you? Look yourself in the mirror. And I just go back, and sometimes we travel, we go on trips, we go to different places, wherever I feel channeled to that energy. Every session is different. Whatever I feel that's in their energy field, I connect with whatever's in their energy field. Sometimes I can connect with their animals, their pets. Sometimes I can connect with places they've been, even in their house. Every session is different. So I can't tell you an exact outcome, but I've had such really, really neat experiences with my clients, and I really enjoy what I do.
It sounds like it's a unique experiences
yes, it
too,
is.
Which nowadays I think we live today in a world that is often very commoditized, and it's refreshing to see that what you're describing is perhaps an anecdote to the commoditization that we're all facing too.
Absolutely. I think we have the solution. It's the mind, body, and spirit needs to be in balance. And spirituality is now being recognized. It's coming to the forefront. And there's a new, higher consciousness of awakening out there. People are really waking up, and they're realizing there's more to life than just work and taking a medication and being on a rush and just relaxing. And there's other modalities that do work.
Well, beautiful. Well, let's take a little bit of a shift to Tom. And Tom, tell us a little bit about yourself too, in terms of you're a life coach and health coach. Tell us a little bit about your work too, as we get.
Well, hi, Jay. Thanks for having us here. Working with Eve right there. Jay, we're in the first time in the people that actually your children are dying before the parents are dying. Actually, I brought a little example. This is a I got from a cardiologist. This is a buildup of artery walls. Now, if I asked Eve, this is the second stage of artery buildup right now. If you can see that there.
Yes, I can.
Second stage. What age do you think this is?
I would say maybe 50.
Okay, and I think you said
I said 30.
30. In reality, Jay, this is actually 12 years old.
No
and thanks
way.
from fast
Wow.
food, okay? And if you think about fast food, McDonald's, Burger King, and Pizza Hut, and this is 100% reversible. And I teach people how to reverse that. We can clean this out. But so we're actually at disadvantage with our growing up in today's society because our parents are feeding us fast food. Our children, think about taking to McDonald's, and if you think about the food there, what the fast food people have done is that you can get a lot of food cheaply. That's exactly what they're supposed to do, and they do an excellent job at it. But you're not supposed to live on that food all the time. And people actually have done that, lived on that food. So I take this and I teach people how to reverse this. In my first session with people, what I'm doing with a session with people is that I spend an hour. I try to set them up a 6-month program. We meet twice a month for an hour, okay? By the time that 6 months period is over, I teach them how to cook food. I teach them the best food to eat. I teach them actually where to shop. I also would call a kitchen cop. I go over their house if they want me to, and I look at their labels. I teach them how to read labels. And after 6 months, they've got a really good handle on what direction they should be going. And a big important part is water. I mean, people don't realize how much water they should be taking in. And I always tell people it is half of their body weight in ounces of water a day. And that if you're outside working, if you're sweating, it's more than that. If you're not doing anything, you need that. All of our organs, all of our vital joints, everything that we need in our body needs H2O, needs water. And people do not give themselves enough water every day. So that's what it would. And if you go to see a doctor, they spend about 15 minutes with them. I spend an hour with them, and I brought actually a big book. We go through this whole book, and we teach them how to cook, teach them how the different vegetables, what vegetables to buy, and they get really good results. And that they have a really good idea of what direction to go.
That sounds fabulous. How do you manage to keep folks? I would think that some of the challenges are staying on the regimen. What are there motivational techniques that you use to keep folks on the regimen?
Not so much motivational things, but for instance, when I talk to people, I have give me a food journal. And I look at their food journal. For instance, they put greens on it, they eat a salad. Okay, usually it's a salad, might have some croutons on it with 2 things of blue cheese on it, and they call it, that's their vegetables. Well, people don't realize that if they're getting Bibb lettuce or any kind of lettuce, there's 90% water in there. There's no nutrition in that. You need to eat dark green vegetables, okay? And how you cook them. If you cook vegetables over 180 degrees, you throw them in a microwave, there's 0 nutrition in vegetables. No, you don't want to cook them any higher than 180 degrees. And we can show them how to cook. I bring a pan in and show them how to cook. Now, after 6 months, if they decide to go to the fast food place, I can't help that. But if they don't, they get a real good handle on which direction to go.
Excellent. So you don't we're now going to commercial break,
Okay.
and then we'll.
All County
Like Elvis,
Healthcare
you're thinking of Elvis
is
Presley.
locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, my name is Deanna Barron. I'm an RN with All County Health Care. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need. And he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
So let's do them on here.
Got it?
I got it.
Oh, yeah. Oh, yeah. It was black.
We can take it after.
Welcome back to You and Your Doctor, Living Longer and Healthier, a AMP2.TV production, sponsored by allcountyhealthcare.com, and where patients are the heart of our business. And call in now toll-free, and call them toll-free at 888-717-7170 for more information. And Dr. Preste, Paul, we'd like to start the introduction to your discussion now. I understand that your specialty is in diabetes and hypertension. Could you tell us a little bit about yourself and about that?
Yes, actually, my specialty is internal medicine.
Sorry.
And in internal medicine, which is really, it's adult care, age 18 and older. And we diagnose and treat multiple conditions, of which 2 are hypertension and diabetes. But we also diagnose and work with patients who have coronary artery disease, all the way to muscle problems or other disease states that can affect them at any age from 18 to 100 years old. So, yes, I do diabetes and hypertension, and along with Dr. McWhorter.
Yes, and welcome, Dr. McWhorter, here, too.
Thank you very much. Appreciate you having me.
Dr. Preste, a quick question on diabetes, because I think it's misunderstood just as a lay business person. But while I know it can be treated and is well treated, tell us about the disease, if you could, the genesis of it, because I think it is misunderstood by a lot of Americans.
Yes, diabetes is definitely a problem that many, many people around the world are having, not just in America. And it also is a problem that can be treated, but not generally well treated. In the initial stages, we can treat it well, but it is a progressive problem, and it's a problem of insulin and insulin resistance. And these are things that can occur from what's known as a heterogeneous cause. In other words, multiple causes that can lead to diabetes. And hypertension is another entity that we see commonly in the medical practice. Dr. Snipes, Dr. McWhorter, Dr. Williams, myself. And that simply is increased pressure in the intravascular arterial system of the body. And because of that increased intravascular pressure, phenomena can occur that causes early aging and difficulty getting blood through those aging arteries, which can then be the complications of stroke, heart attack, poor ability to walk distance called claudication when the blockages are in the muscles going to the legs, and a myriad of other complications of hypertension. And also, those complications are mirrored in diabetes. You can get those same hardening of the arteries, same stroke phenomena, coronary artery disease, myocardial infarction, claudication, and other organ damages from loss of or poor blood flow due to diabetes and hypertension and the ravages that occur if hypertension is not well controlled, and the same ravages that can occur if diabetes is not well controlled.
It sounds like you're talking about something that's both systemic and circulatory, if I'm not mistaken.
It's systemic that affects the circulation everywhere from the scalp, the brain, down to the toes.
Which explains how it really your whole body is affected. Eyes, for example, feet. It's all explained by that pathway you just described.
No, you said it well. It's a systemic problem. Hypertension, diabetes, but so many disease states that occur, after your 20s, 30s, 40s. So many of these disease states are systemic.
And that's usually how we actually find it, if you don't mind me chiming in.
Please.
It's because patients come in with a particular complaint, like their vision is bothering them, or they have a sore that won't heal on their skin, or they keep having urinary tract infection, or sometimes it does show up as cardiovascular events because they have an increased risk for them. And so a lot of times these specific complaints actually help us to find the diagnosis, help us to uncover the diagnosis, if you will, of diabetes. I didn't mean to cut you off, Preste. I just wanted to jump in.
Dr. McWhorter comes to Preste Medical most recently for a long term as hospitalist.
Yes.
And hospitalists are those doctors who you see when you go to the hospital for some problem that really has not been diagnosed, and it's up to the hospitalist to get that patient in, diagnosed, treated, and released. And that's why we're very happy at Preste Medical to have Dr. Julian McWhorter, because if you have a problem, he knows diagnose and set you on the path of best treatment.
But with respect to treatment, could either one of you comment in terms of the modalities that are available? I know there's a lot to put in a couple of minutes, but if you could comment on the modalities of treatment and what's the new trends, next generation of drugs, for example, in this modality.
If I may go first, and then I'll turn it over to Dr. McWhorter,
okay.
Dr. Preste here. The important thing is with blood pressure, 138, 140, 136, the top number, 90, 100, 110. Those are numbers that are somewhat problematic. Normal blood pressure for most people is 120 over 80. But when you start getting 130 over 90, those are the times that you have to be evaluated. And sometimes just simple things like putting the salt shaker away, and or if you have diabetes, increasing your exercise early on in diabetes can often change your course and slow that progression down. Now, we at Preste Medical have Dr. Ed Smoller. He's an endocrinologist, very respected in South Florida, and Beth Greenberg, our practitioner, who also is very, very versed on diabetes. And as you can imagine, something that's affecting the whole world, there are many, many drug companies, and you are right, there is a number of treatments, new modalities. And the reason is because if we had some good treatments, the best treatments, we wouldn't need to be creating new medicines all the time to try to grab market share. This is big business, and there's myriad of from insulin injectable to metformin, and on the list goes. And Dr. McWhorter, I'll turn that over to you at that point if you want to make any comments about hypertension, diabetes, treatment of.
Right. Well, I think I'll start off with diabetes a little bit, in the sense that it affects about 40% of our population here in the U.S. So it's a growing concern, especially with the epidemic of obesity. part of the biggest thing that I try to give my patients as a tool is behavior modification. And I think that also includes my friends here, Ms. Eve and Mr. Tom, which help us out with that, which I call behavior modification, such as diet and exercise. And those two simple things go such a long way with helping us to combat this disease. I didn't know if y'all wanted to add anything on. I know I'm.
Go ahead, you're fine.
Yes.
Yes, you're right. Yes, you're right.
And so-
Absolutely, 100%.
And so that's one of the major things. And a lot of times I find that in the hospital setting, bringing that experience to the outpatient setting, is that a lot of times people are quite upset when they find out they're using insulin for the first time or whatnot. But it doesn't mean that you have to stay on insulin. A lot of times when people come to the hospital and they're not and they're that sick that they need acute care, they're what I would let, if you allow me to use a little medical slang, they're sugar toxic, which just means that the sugar's overwhelming their system and it's going to take more to kind of get that sugar under control. But when you start talking about behavior modification, such as diet and exercise, and we go into that in more depth later, then all of a sudden, once you get past that stage, you get better control. We can start out with simple things like metformin, and we can go on how those medications work or whatnot. And that goes a long way with increasing your survival, decreasing morbidity and mortality. Did you?
It sounds like, from the perspective of all of you, it's almost like everybody plays an important part at the professional level, whether it's behavior modification or the actual treatment and diagnosis and then evaluation. So it's fair to say every patient's treated pretty uniquely on all of those levels.
Very correct. And a lot of times I do like to use a team approach because I want to increase the activity of my elderly patient who may not be actually ambulating enough to and fro with the activities of daily living. We might have to talk about behavior modifications such as diet for somebody who's mid 30s, mid 40s, or whatever, in that what do you call it, within the grind, the everyday grind, and trying to find healthy choices. And so I think that it's a simple but complicated conversation that you have to have with each individual to find out what behavior modifications you can actually do to help them to achieve their goals.
Also, I want to add that deficiency, toxicity, and inflammation create disease, and also stress with the high cortisol levels and the adrenaline failure in the body. Those are all factors that contribute to someone who's being unhealthy. So, and it all starts with the mind too, because if you think you can get to where you want to go and you can reach your goal and it's a lifestyle change. It's just not a diet. People say, oh, I got to go on a diet. But no, it's a whole entire lifestyle change. You've got to change the way you shop. You've got to change the way you eat. You got to change what you do at night. It's just behavioral changes, that modifications that lead to success.
And some of those can be so simple. Some of those could be where you park your car. Some of those could be we can drive this place. We can get in our car. We can pick our prescriptions up, our dry cleaners up, everything we can pick up, and without even getting out of our car, park. All those are called functional.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you. and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
We got.
Okay. And we are back. Welcome back to You and Your Doctor, Living Longer and Healthier, a AMP2.TV production sponsored by All County Healthcare, Inc., where patients are the heart of our business. And the call-in and toll-free number, 888-717-7170 for more information. As we reconvene, I'd like everybody to give their contact information and where they can be reached. So,
Okay. Our contact information, Tom and myself, Tom Woderski and Eve Preste, we're both located at 3077 East Commercial Boulevard. That's Prestige Wellness. We're upstairs. Down below is Preste Medical, and we're upstairs. And my contact number is 954-263-9555. Our website is www.prwell.com. And also, you can like us on Facebook, Prestege Wellness. And also, there's a second location at the meetup spot, which is 2499 Glades Road, Suite 209 in Boca Raton. The meetup spot, you can find them on Facebook as well. And I do hypnosis and meditation there as a second location.
great, thank you. And Dr. McWhorter?
Yes, I'm Dr. Julie McWhorter. I'm the newest doc on the team at Preste Medical. And again, our address is 3075, that's 3075 East Commercial Boulevard, Suite 1A, Fort Lauderdale, Florida 33308. That's Commercial Boulevard, that's 3075 East Commercial Boulevard, Suite 1A. And the phone number is 954-491-6200. That's 954-491-6200. And the fax number is 954-491-6419.
Great. And Dr. Preste? We get his contact?
I'm at the same place as Dr. McWhorter downstairs where Preste Medical is. We've been in existence for 36 years. And Prestige Wellness is where Eve and Tom are located, and they are doing a great job. We also offer skin care, acupuncture as part of the wellness, and soon to bring in testosterone and hormone replacement for men.
Excellent. Sounds like quite a holistic experience, docs.
Yes.
We have a great experience. It's east upstairs meets west downstairs. The allopathic practice downstairs with Dr. McWhorter, Dr. Williams, myself, Dr. Preste, Dr. Smoller. Also, we have another new internal medicine doctor that we're hoping will join us, and that's Dr. Julian McWhorter's wife, Dr. Ivy McWhorter, and she also is an internal medicine doctor.
Excellent. With all of that, I guess maybe I'll ask Dr. Preste the question first. 36 years, that's very, very impressive. Could you tell us a little bit of the evolution or the genesis of both your backgrounds and how you came to form this?
Well, I formed it back in 1981 when I came back home to practice internal medicine amongst the population and the people that I grew up with here in South Florida, Pompano Beach and Fort Lauderdale. And I assumed the practice that had been in existence for 25 years at that time. So it was busy from day one, and through God's graces, I've aligned with some excellent doctors. Dr. Voss, he passed away unfortunately, and Jackie Woods, nurse practitioner, Dr. Smoller, Dr. Prieto, and many, many other doctors that everybody in the earshot of this radio station will know, as I grew through the last 36 years, knowing the best of the best doctors in South Florida and making sure that our patients at Preste Medical are always directed in the right way to get the best care offered in South Florida.
Fabulous. Well, to shift a little bit, going to maybe the patient side, all of you actually explained the role of the patient, and perhaps what I've seen the trend is the mindfulness of the patient is changing dramatically to a much more educated patient than the old days or the old paradigm. What do you see in the trend at the patient care side of this that I think would be interesting to discuss?
Well, I'll just give you the brief answer. Yes, it's nice to deal with educated people in their healthcare problem. It's called Google. and it's nice when you can Google something, read about it, and then have a more intelligent conversation with your doctor. It's not just a lot of words and concepts. You've actually read something, you took the time to think about it, now your doctor can put it in perspective, and you can get a better outcome. Dr. McWhorter?
Well, I agree. Patients are living longer and we understand more about diseases and we have more options for them as well. So a lot of time I think it's a continuing education and you're trying to take it one step further because you have the extra step that you have to do so because of the longevity of the patient, also because of the tools we have at our disposal to help our patients, or what I like to consider our extended family. And we all love our families and we cherish them, so we want to make sure they get the best that medicine has to offer. And that's one thing I think has been consistent with the Preste way, and I really want to continue that excellence and expertise. And one of the other things is that even if we need to bring them back to make sure, as you fine-tune things, to make sure that I think it's important to empower the patient so their treatment plan slowly, if they don't already assume that autonomy, but becomes their own. So they can actually say, this is my physician, this is my treatment plan, this is where we're going with it, and really empower the patient. So that's another facet of their lives that they actually take control over and they assume the authority for themselves so they can really make sure they stay on the tracks themselves. I think it's so many times in life that we do that in other arenas, but for some reason, medicine is not one of them. And so I really encourage and like to empower my patients.
You know, Dr. McWhorter, I wanted to say two things. You hit the longevity. And like it or not, a lot of us are going to be living to be older, 90, 100, maybe 110. Longevity
Wow.
hit our family. Longevity hit our family. My dad, born in 1912, passed away 3 years ago in 2013 at 101 years old. Now, the other thing I wanted to comment upon before I turn it back over to the group is that All County is a very, very good home health agency. I've been working with them for a number of years. I feel very confident and comfortable that they always err on the behalf of the patient, which is a lot of the other corporate level home health agencies. They sometimes don't have that same sensitivity. And at All Care, they always err on what's best for the patient. I suggest them strongly. And the new wave of healthcare is starting to use home health agencies more and more and more. Home health agencies can sometimes keep a patient from having to go back to the hospital and have very good nursing care in the home. And home health agencies are doing a lot for improved health care across the country, and we're very fortunate that we have a Dade, Broward, and Palm Beach tri-county health care with All County Health Care. With that, I'll turn it back over to the group.
Just to chime in on what you were just saying, Dr. Preste, was that with good home health care can make a huge difference and allow a patient more access to the medical system so they can stay in the comfort of their own homes and still receive good quality medical care at home.
You know, Dr. McWhorter, that's exactly right. And so much of healthcare now is so uncoordinated, and it's so frazzled and disjointed. If you can get to a great office with good co-management of healthcare issues for the patient, which we have at Preste Medical, you can often really improve healthcare outcomes with the right team as your doctor office.
It sounds like a wonderful group effort by all of you in the way you're describing the practice. Helpful to know that patients, I find as an executive coach, for example, accountability is really a very, very important element to actually getting positive outcomes for just about anything.
Yes.
Can you folks comment on accountability and how you kind of get the patients to get to an accountability quotient?
Well, a lot of times what I do, if a patient is non-compliant with a treatment plan that we, and I say we have already agreed to, the patient and the medical team, I ask them, why have you not fulfilled your obligation? Or why have you not been able to meet these mandates? Why have you not picked up your Medicaid? Whatever it may be, I want to know whether it's a transportation issue, whether it's a medication issue, because I can prescribe medications all day, but there's an issue that you can't access the system or obtain that medication. It didn't do anybody any good. You made me feel good by writing a script on the paper, but did it do anybody any good? And so these are questions that I ask, and it's part of them taking ownership of their own health care, but let me know how can I further assist you? How can I be your advocate? How can I help you to get where you need to go? And I always tell my patients, think of me as GPS. I'm going to give you the options here, but it's up to you which way you want to go with this.
Great.
Also, I want to add, with my clients, I look for energy blocks. I find out what's blocking them. Maybe their home environment, the energy there, there must be disruption in the home, or there's blocks where in their home life or with their friends, like certain things that are blocking, or their mind where they believe they can't do something. So I like to flip the switch to a positive mode where, yes, they can, like Julian said, to feel empowered, where they want to make that change. They want to live longer. They want to wear that favorite outfit that's in the back of their closet that's just waiting to be worn, or something that's, an event that's coming up, a cruise or a dinner party, that they want to look their best and feel their best. So I really get them motivated. It's all about motivation and empowerment. And thank you, Julian, for adding that.
Thank you.
So it's really kind of the new paradigm is the way of getting a higher sense of attunement and getting the patients to realize not by the old school, which was very frequently guilt and haranguing. And we've all kind of learned professionally that doesn't work for the most part. So the higher level, and I guess, Eve, that's where your calling comes in to kind of like balance this all out, too.
Spark some enthusiasm.
Right.
And sometimes that's all it takes, something to get them excited. You got to be excited. We got to wake up in the morning with a passion, excited about that day, the brand new day, to see what it's going to bring you. And I just like to motivate people so they can be the greatest person that they were meant to be in this lifetime. Because you get one shot. You might as well be the best.
Well, and now let's go to a commercial break.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to You and Your Doctor, Living Longer and Healthier, a AMP2.TV production sponsored by All County Healthcare, Inc., where patients are the heart of our business. And the call-in number is 888-717-7170 for more information. Question I'd like to ask the doctors is, we've gone in depth to the quality and the firm and the patient care. I just wanted to spend a minute on shifting from local to global, and maybe ask what's the state of American healthcare versus the global?
Preste, are you still there?
I am. Yes, Dr. Preste. Well, I was going to let Dr. McWhorter comment on that, but I'll go first.
Okay.
I believe that population health management is the problem. Population health management is the problem. There are a lot of good countries out there offering great health care, but are the people in that country participating? Are the people in that country able to get to health care? So you could have the greatest system of actual care for disease states, which I believe we have in the United States. But if you don't have the necessary ability to get that to the population at large, well, then you're a great system, but not really being effective. So we are trying to be more and more effective in America by getting the great health care that we have to all the people. So in answer to your question succinctly, I feel that healthcare in America is one of the leading in the whole world, and we have the same problem as every other country, rich or poor, and that's getting whatever health care you can offer to the people that need it.
So perhaps at times in the media, our country is not as maligned as it is doing much better than sometimes is referred to?
Well, I will tell you this. There have been certain things that have occurred since 2010 that we now have many more millions of people being insured. And so many more millions of people in concern for population health management are now receiving medical treatment that they may have heretofore gone without because no insurance, fear of the bill, fear of other things. And so as we left 2010, we now have many millions of more people who are not in the healthcare system who are now in the healthcare system.
So I gather you're in favor of enlarging the tent then along those lines.
I'm sorry, what was the question?
It sounds like you're in favor of enlarging the tent where more folks and more patients can enter as a result of the having healthcare insurance.
Oh, I believe that we should all start at 18, 20 years old and start determining, do you have risk factors for heart disease, for diabetes, for stroke, for myocardial infarction? The earlier that you can get into an understanding of your personal health or lack of, the better chances you have of living longer with less morbidity, less disease. And less disease as you get older means less expenses on the country. So I'm all for having the ability to go see a doctor and having health insurance, even if it's just more for catastrophic. You end up in the hospital, you don't want to end up with a $300,000, $400,000 bill. So at least get catastrophic and pay a few dollars to the doctor, but at least have catastrophic health care for those unforeseen eventualities.
And I'm in agreement in the sense that we talk a lot about allocation of resources, but we do have a lot of resources. And I think what Dr. Preste said was key is about starting young. Even at our family reunions, one of the things we teach the youth is that we talk about family history. What does it mean that granddaddy has this, our grandmother has this, our nana has this, our papa has this? And what does it mean? How do you affect change with your social history about what you decide to do, what you decide not to do? Your body is a temple. Be careful what you put in it. I mean, all of these things ring true because, and to break it down, when you say, you don't want to cost the healthcare system a lot at the end of life. But let's also think everybody wants to enjoy in the life. You work to get to retirement so you can enjoy your golden years. But if you are hooked to a dialysis machine or if you have to stay in the hospital, I mean, you're not going on those cruises. I mean, you can't leave your house. And so I think one of the things that we have to make sure, like I was saying before, empower the patient to take a hold of the opportunities that are there. And just like Dr. Preste said, now there's much more accessibility to a lot more people, so they can actually utilize the services that are there around them. A lot of times it's just making sure they know about it, because a lot of times when I ask them the question, well, why were you not able to do this? Why weren't you able to get this medication? Why couldn't you get to this appointment? You kind of find out, okay, you need Meals on Wheels. Okay, you need home health to come into the house. But these are things you only find out when you have that discussion with your patient, or what I like to call with my family member that I just been introduced to by the staff. And so that's what makes a difference.
I agree, Dr. McWhorter. One last thing before we run out of time. I was a little delinquent in mentioning Dr. Snipes, Dr. Frank Snipes. He's also an internal medicine doctor who's been with us for several years and does an excellent job for and at Preste Medical.
And Miss Donna as well. I'm going to blank on her last name. Miss Donna Golden, who makes a lot of the magic happen in the office.
It's wonderful because it seems like we've covered today the 360 degrees of both the practice and the patient, and looking at the whole holistic, including the spiritual side. One of the things as we kind of draw to the end of the program is it seems like the team has done a really good job at taking the stigma out of disease.
Thank you.
Thank you. I appreciate that.
That's well put. Yeah.
Yes.
Because if so many folks won't go if they view that their diagnosis, particularly most of these things are not death sentences anymore. As a matter of fact, you can get aboard the train and be treated.
Right. And what I would do is challenge them is like, live life to the fullest. Give yourself an opportunity to live life to the fullest. And if you don't go see your doctor to find out what things you can do to improve your quality of life, you're not really giving yourself that opportunity to really shine the way that you truly can.
And if you don't set goals, see goals, or have goals, you're never going to get there. You have to know where you're getting and in order to get there.
Well, once again, let's maybe go around and offer our contact information and.
Okay. Prestige Wellness. That's Eve Preste with Thomas Widerski, 954-263-9555. We do acupuncture. We do hypnosis. We have Reiki, teeth whitening, nutrition, and organic facial skincare. And downstairs, we're going to have Botox and aesthetics. And the number again is 954-263-9555. And the website is www.prwell.com. My email address is prestege wellness@gmail.com. And on Facebook, it's prestege wellness. Thank you so much.
And Eve, if I can add one last thing.
Sure.
We also are beginning the testosterone at the Prestige Wellness.
Okay, we're going to add that as well.
Testosterone replacement, yeah.
Thank you, Paul.
And again, this is Julian McQuarter, and I'm with part of the physician practice that is downstairs from the Wellness Center. And that's at 3075 East Commercial Boulevard with Dr. Snipes, Dr. Williams, Dr. Smoller, and Miss Jacqueline Woods and Miss Beth.
You got it. Yeah.
And our whole team of ladies who make their magic happen behind the scenes.
It's a wonderful kind of total experience. I really appreciate that. My name's Jay Feldman. I'm an executive coach. Been down here for over 35 years. Partners with Lorena Anderson. We are hoping to bring the combination of both life coaching and business coaching together and create synergy, as you folks have done, from a total integrative experience also. Thank you today also for looking and explaining to us both the patient side, the labyrinth that patients go through and how they can mitigate those circumstances, and giving us the positives and taking the stigma out of what it's like to be a patient in 2016 and beyond. Any last thoughts in terms of modalities and new trends in the business and what you folks would like to see in the future from the practice, from a vision standpoint?
Well, that's a bunch of conversations that I look forward to having with you later on.
I'm sure we'll be back. Yeah.
Well done, Dr. McQuarter.
More to come, right?
Thank you, Dr. Preste.
Well, it is
Very
important.
good.
It is very, very important. We're in a world today. We're in a world today where there's a lot of negativity, cynicism, and people are looking for an uplifting, positive experience from all of us professionals. And it's refreshing to see that you're addressing it, the practice is addressing it. So thank you very much once again. And we look forward to hearing from you again in the future in terms of the next generation of what we can expect from the practice and further conversation.
Come on down and be the best you can be.
Come on down. I'm looking forward to coming down in a positive health experience, not any disease etiology.
Thank you so much. Thank you for the opportunity.
Have a good night.
You and your doctor in healthcare at AMP.TV, production sponsored by All County Healthcare, Inc., where patients are the heart of our business.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those